Aloha and good afternoon, everyone. Thank you so much for having me. My name is James McCowan, and I serve as the Director of Community Preparedness and Resilience at Hawaii Public Health Institute. In this role, I work across our programs to help integrate a climate resilience lens into our public health strategies statewide. I'm really excited to be joining this One Health Symposium and excited to share a bit about the work going on here in Hawaii to address the human health piece of the One Health framework. Today, I'm going to be talking about one of our initiatives called the Climate Change and Health Working Group, which is an all-volunteer coalition of healthcare providers, public health professionals, researchers, and community advocates working to strengthen Hawaii's public health response to the climate crisis. But before I dive into all that, I wanted to briefly share a bit about how I came into this work, and just show how there are so many different paths into climate advocacy. For me, I grew up in a coastal town on Long Island, New York. My family is Puerto Rican and Irish, and so I've always felt connected to various island communities in different parts of the world. I joke about it here often, but I've definitely had to explain to people here in Hawaii that Long Island is technically an island as well. But what's been more interesting to me are the shared values that I've come to recognize across Long Island, Puerto Rico, and Hawaii, especially the deep cultural and emotional connection that people feel to their land, community, and place. That connection to place is also paired with, unfortunately, shared vulnerability to natural disasters. I grew up seeing firsthand the impacts of events like Hurricane Sandy in the Northeast. And I've family who've lived through Hurricane Maria in Puerto Rico, and those storms have really devastating impacts, but they also revealed the resilience of island communities. In 2017, I joined the Peace Corps and served as a health volunteer in Vanuatu, an island nation in the South Pacific. I lived in a remote indigenous village and worked on a water access project that had become urgent due to a prolonged drought and one of the many climate-driven disruptions communities there were already adapting to. And that experience really shaped how I think about climate change, not as some distant future threat, but as something already shaping people's lives in a very real and multifaceted ways, especially in island settings. About a year after my service ended, a Category 5 cyclone hit Vanuatu, and it happened during their national election, and right as COVID-19 was beginning to spread globally. And it was one of the clearest examples I've seen of climate change acting as a threat multiplier, and also of the incredible resilience that exists within local knowledge and community networks. After returning home, I pursued an MPH focused on climate change and health. I eventually found my way to Hawaii. I worked on several climate-related roles before joining the Department of Health in 2023 to help launch their first climate and health program. And it was clear right away that there was a major gap in this space. Public health in Hawaii was not yet fully engaged in climate resilience work, so that need to better bring a health lens into climate change was one of the main reasons why my colleagues, including Dr. Sandra Chang, who was also participating in this symposium, and I came together to build the Climate Change and Health Working Group. And so I know this audience understands the basics of climate change, so I won't spend too much time there. But I do want to start with a few trends that are especially relevant for us here in Hawaii. This graph shows temperature changes across the islands since the 1950s. And as you can see, temperatures have been rising steadily across all of Hawaii. This graph is similar, but it also includes projected temperature increases for our islands. These projections are a major driver for our work. There are a lot of important initiatives here focused on reducing emissions and transitioning to 100% renewable energy. That work absolutely matters. But as you all know, even if we stopped emitting carbon dioxide today, our climate system has a lot of warming already built in. So, in addition to mitigation, we also need adaptation, and we need to strengthen our health systems to respond to the full health impacts of climate change moving into the future. The simple reality is that it's projected to get hotter. Compared to the 1951 to 1980 baseline, global temperatures have already increased about 2.3 degrees Fahrenheit on average. These representative concentration pathway models, they're just different possible futures. And so that red band here is the so-called business as usual pathway, where emissions continue at a high level, I mean, we end up several degrees hotter by the end of the century. And so the green band below it represents the lower emission future. But even then, we still see warming above our historical baseline. And so we are unfortunately committed to some degree to greenhouse gases that have already been emitted. And so here shows some of the major environmental changes we are facing in Hawaii: rising air temperatures, decreases in rainfall and stream flow in many places, but then also more intense rainfall events when they occur, sea level rise and increasing sea surface temperatures, and then also ocean acidification. And so these are the public health and environmental issues. They shape the kind of health impacts communities are already experiencing and will continue to experience. Here's our roadmap. We call it our climate change and health pinwheel graphic. We adapted this from work by the CDC and the California Department of Public Health for us here in Hawaii. When we say climate change is a public health crisis, it's because we see all these different areas of health being threatened by climate change here in Hawaii, and that includes heat, wildfires and wildfire smoke, extreme weather and flooding, impacts on water quality, impacts to our food systems, and the risk of invasive species and mosquito-borne disease reaching our shores. This graph is intentionally broad, and as you can see, it's so interconnected, and it can feel overwhelming at first when you first see it. But we found it to be a really excellent roadmap for our work. It's just a simple way for us to explain what we mean when we talk about the health impacts of climate change. And so now jumping to showing how our working group organizes itself. We formed in 2023, at first mainly just to learn from different experts about different climate and health impacts across the state. But then as the group steadily grew, we realized that we had this growing body of expertise and a real desire to evolve from just learning towards action. And then we also realized that we were pretty siloed within health professionals. And if we really wanted to do this work meaningfully, we needed to hear directly from the communities most impacted. Here in Hawaii, we have so many different microclimate, and people experience different climate impacts in all different ways depending where they live. And so we wanted to hear directly from communities to help us understand which climate and health issues we should prioritize our limited resources first. And so that led to our community listening sessions initiative. We had received some modest funding from a local health system to support informal talk story sessions. And the purpose of these sessions is really simple. It's just to listen. We want to hear directly from residents about how they see climate change affecting the health of their families and communities. We usually begin each one with a short 10-minute overview from one of our physician or nurse members explaining that pinwheel graphic I showed earlier. But then we spend the rest of the time just in an open discussion format, just hearing from people, asking them, how are you experiencing this where you live? And those insights that people have shared have been incredibly valuable. We've heard concerns about heat, dry and drought conditions, wildfire risks, and water quality issues linked to old cesspools all across the state that impact our recreational swimming. People have also raised worries about, particularly in West Oahu, they have a single access road. So the ocean's on one side and the mountains are on the other. And in an emergency like a wildfire or a major storm, evacuation would be really difficult. And that understandably creates a lot of anxiety. So our first listening session was focused on West Oahu, in part because of existing relationships with those local health systems there, but then also there were some clear climate health vulnerabilities in that area. And so this is a heat map, and it shows some of the hottest parts of Oahu. It includes the urban core of Honolulu, down in the south here, and then the coastal West Oahu, where many Native Hawaiian communities live. And these areas are already facing high heat exposure, and it's expected to get hotter in the years ahead. If you're unfamiliar and you're wondering why urban Honolulu shows up as a hot area on that map, it's because of what's called the urban heat island effect. So it's not necessarily climate change itself. It's a human-made condition that makes rising temperatures even worse when you have areas with lots of concrete and asphalt that absorbs the heat during the day and it releases it slowly at night. But then those places generally tend to stay much warmer. But more vegetated areas with trees it helps cool the air through shade and evapotranspiration. Urban environments, though, we've replaced a lot of that natural cooling with buildings, pavement, and traffic. And so it's why the temperatures in the urban core are often higher than the surrounding areas. And during heat waves, the urban heat island effect makes these conditions a lot more intense. But so yeah, back to this heat map. So it helped kind of shows why heat was already emerging as an important concern in some of our early conversations. This map here shows the percentage of residents living below the poverty line on Oahu. And as you can see, a lot of those communities that were on the hottest regions on the previous map also have some of the higher levels of poverty. And so that convergence of heat exposure and socioeconomic vulnerability was why we wanted to start our listening sessions grounded in West Oahu from the beginning. And these just show a couple more images from those sessions. Um, Again, we just kept hearing similar concerns about heat and dry conditions and wildfire risks. But these sessions really quickly became foundational to our group. And honestly, they've been the parts of this work that I've definitely enjoyed the most. We've since expanded over the past year to more Kapuna focused events. And so Kapuna in Hawaii, it just means elders, older adults. And we know that they're especially vulnerable to many of the health impacts represented on that pinwheel. And so this just shows a bit of those sessions here. And so this is a pilot that was made possible thanks to a small grant from our local Department of Health's Office of Health Equity. And so, in this work and doing these listening sessions and organizing, we made a commitment early on that our engagement would not be extractive. So, we didn't want to just gather stories. We really wanted to appropriately respond. And so, that means following up with resources that address the concerns that people raised. And so, here you can see some heat safety materials that were developed through a collaboration between the Department of Health and each of our county climate offices. One of the strongest outcomes of our working group is the ability to break down silos and facilitate these collaborations between these county climate offices and the Department of Health. Our working group members helped to review this content, make sure that it was relevant and useful for reducing heat related illness. And so the collaboration helped support even more. We've done more materials with the county offices, and we were able to bring them back to the folks and communities that we had first heard from. And so heat was not the only concern that had come up in the sessions, but it was definitely one of the strongest reoccurring themes. So I just want to go back to this graph, kind of showing how our group organizes itself and functions. And so hearing from communities has really been the guiding driver of our work. And so it led to the initiatives like the materials that I mentioned, but then also various projects and also our advocacy work. So I'm going to just stick with that common theme of heat, which we had heard, and share a little bit about how that has developed. So here shows a news article about Maui High School football players who were hospitalized for heat illness back in 2015. As you saw, the data shows it's getting hotter across Hawaii, and that means our most vulnerable groups are increasingly at risk. So on the opposite end of the age spectrum from older adults are our children. And here's just another example of how heat has already been discussed as an issue in Hawaii, especially around hot classrooms and how they disrupt learning. But we wanted to look more broadly at heat in schools and think about how we can reduce actual cases of heat-related illness for our children. Thankfully, here in Hawaii, we have not experienced a known heat-related death in a school setting, but unfortunately, this has not been the case in other parts across the US. This slide shows a case from California where in August 2023, a 12-year-old student named Joshua Robinson suffered a fatal heat-related illness during PE class due to extreme heat. And then about a year later, California's governor signed legislation requiring public and charter schools to develop heat safety protocols, weather monitoring plans, communication procedures, and training to include outdoor protections for things like PE, recess, and after-school programs. And so we wanted to follow this model and be proactive, not just reactive in case a tragedy were to occur here. And so for part of that work, we connected with the Corey Stringer Institute. They're one of the nation's leading research and policy centers focused on exertional heat illness. They've already worked with the Hawaii High School Athletic Association, and they had visited Hawaii to meet with athletic trainers and others to help develop guidelines. They rank states based on heat safety protections in school athletics, including heat, but then also emergency preparedness and head injury protection. And as you can see, Hawaii ranked 24th in the nation for all these protections, just right in the middle. And so it tells us that there are some important, great pieces in place, but there's also a lot of room for improvement. And if you're not too familiar with heat safety metrics, one of the most important concepts is called the wet bulb globe temperature, or WBGT. This is different than heat index, which is what most people are familiar with. The heat index combines temperature and humidity to estimate how hot it feels, but WBGT is more useful because it takes into account direct sunlight, wind, and radiant heat from surfaces like turf and asphalt or track. And so it's why this metric is used by the military, athletic associations, and OSHA. It does just a much better job of reflecting real world heat stress on the body. So if we want to better protect our kids, we really want to be making sure we're measuring things in the right way. And so here's an example of some of those WBGT devices. The one on the left is like a cheaper version that you can buy online for I think around like $50. Then the one on the right is a Kestrel 5400, which the Corey Stringer Institute recommends as the gold standard, and I think it costs around like $550. But practically speaking, these devices are like really straightforward to use. You just place them on a tripod about average human height, around 5 feet off the ground, and if you put them directly where the activity is happening, like on the field, turf, track, blacktop, wherever students are exercising, practicing, or spending time outdoors, you need to leave the device in place so it can adjust and give a proper reading. Then you continue monitoring conditions over time. And then they'll beep sometimes when even some certain heat thresholds are reached. And there are also indoor versions as well, but it matters because not all gyms or indoor activities here have air conditioning. Then once you get the reading, the question is, okay, how do you actually use it to make decisions? That depends partly on where you live. So different regions of the country are grouped into categories based on typical climate and heat acclimatization. Colder states in the Northeast, will have lower thresholds for modifying activity compared to the warmer regions where people are more heat acclimatized. So Hawaii is considered category 3, and so it shares the same category as a state like Georgia. And so when those wet bulb globe temperature thresholds are reached, there's different modification guidelines that you need to do. I think just the important part here is making sure you have the resources to monitor this. So it helps you make guided decisions about water breaks or reducing practice intensity, removing equipment if it's too hot, increasing rest breaks, just kind of all the things you can do before conditions become too dangerous. And then if it becomes way too hot, you can just delay or cancel practice. It's really helpful to have these just like concrete guidelines that teachers and coaches can use so they're not left making decisions on their own. So thankfully here in Hawaii, we do have some of these pieces in place. The Hawaii High School Athletic Association, it has these guidelines from Corey Stringer, but they are not mandatory. And so this past summer, we worked with 3 really amazing high school students participating in a local sustainability fellowship, and they began recording WBGT readings across their school campuses on Oahu. They also interviewed coaches, students, and faculty to better understand how heat is experienced on campus, and how stronger heat safety practices might actually be implemented. And so this slide shows a snapshot of some of the readings that they collected. According to one trainer that they spoke with, the track is often hotter than the field, which it makes sense, but it's helpful to start documenting that in a more structured way. This just shows the different schools that they visited over the summer. Here's the distribution of some of the WBGT readings that they were recording. I just want to note this was a small scale student project, but ideally we would have WBGT readings on every campus and multiple times throughout the day across a much longer period of time to better understand these trends. So we can't really overgeneralize a lot from this data, but this project was really useful, helped us learn more about how these simple devices are used, and shows that even these snapshot readings sometimes reached levels where activity modifications would have been recommended. And so for our organization, it was the beginning of learning more about heat in schools, and that learning then fed directly into broader statewide advocacy around bringing these best practices into Hawaii. So back here again to the structure of how our group organizes ourselves. Last year, we had realized that we had so many doctors, nurses, and public health professionals engaged in these issues that we wanted to use that collective, trusted voice to strengthen the state's public health response to climate change. And so then we launched a policy subgroup to help some members engage more directly with the state legislature. We just wanted to make sure that the health voice was present in any climate policy discussions, also guided by communities informed by their frontline experiences. And so a lot of our members are the folks treating patients who are already being impacted by climate change. And so having healthcare testimony brings a level of urgency and credibility that's really important, especially in a state like ours where health has often been missing from climate policy conversations. So last year, we helped introduce a bill called HB 245. At the time, it called on the Department of Health and the Department of Education to jointly create heat safety standards. It passed a few committees, but then it ultimately was turned into resolution and stalled. But that was actually before our deeper collaboration with the Corey Stringer Institute and the student-led heat data. And so that helped to inform a stronger bill that was going on this year, HB 1803. And that would just direct the Department of Education to implement the already existing Hawaii High School Athletic Association guidelines that are not mandatory, but it would mandate them for all grade levels, K through 12, and then also appropriate fundings for every state public and charter school to have access to these wet bulb globe temperature devices. And so, unfortunately, the bill actually did die last week because it was not scheduled for a hearing in the Senate Education Committee, but it actually made it a lot further than last year's effort did. It passed through both House Education and Finance committees, it crossed over to the Senate. And so, even though it died this year, we just see this as a continuation of that momentum. And so for the next interim period, we plan to work a lot more closely with policymakers so that this issue is on their radar, and we're better positioned for next session. And so I did also wanted to highlight what has probably been our biggest advocacy win so far. So last year, in our first year as an advocacy group, learning how to operate in these spaces, we were able to help write, introduce, and then ultimately advocate to help pass a resolution called SCR 111, and that declared climate change a public health emergency in Hawaii. Back in around 2021, Hawaii was the first state to declare climate change as an emergency. But if you go back and you read that language, health was completely missing from that conversation. So this resolution was about taking that one step forward and explicitly naming climate change as a public health issue. And thanks in large part to our student interns who've been participating with our working group, they actually wrote the measure. It successfully passed. And this we consider such a huge win for our newly formed grassroots organization, because we really got to see what happened throughout this process. As lawmakers debated this measure on the floor, we could hear them beginning to use the same language and frameworks from our group that we had been using in our advocacy. And it was just really encouraging to watch that learning happen in real time. And so we believe that this is how lasting, longer term policy change can begin. We're just building a shared understanding that led to this type of commitment, and then hopefully we'll build off and we'll have much more meaningful action like the heat bill I was talking about for even other climate and health areas as well. So we were really proud of our students and all of our partners for help to move that forward. And so again, the listening sessions with community really are the core of our work. Without those stories and concerns, I think we'd be much less grounded in on which issue to focus on. There's just too many interconnected issues. It's just limited resources at this time to tackle it all at once. Um, but even throughout the advocacy work, we've invited community members to testify directly as well whenever possible, because their voices are much stronger and powerful in these spaces. And so we really hope to continue serving as a bridge between health professionals, communities, community leaders, and our policymakers so that we can move forward for more concrete solutions for our biggest climate and health challenges. And so we're wrapping up our second year as a group doing advocacy work, and we really hope to keep building this momentum. Um, we had the pleasure of connecting with similar groups in other states doing this type of community-led public health work. And so we're always happy to connect and share some of the lessons learned that we've experienced from building this type of coalition. So happy to chat more or answer any questions. And yeah, just I really thank you so much for your time and excited to learn from you all for throughout the rest of this symposium. So thanks again.